What is anorexia nervosa? Who suffers from it? Is it a quick way to lose weight? Many of our youth ask themselves these questions. Anorexia nervosa is an intense fear of gaining weight. People who suffer from it see themselves as fat or bigger than what they really are. Their view of themselves in the mirror is distorted. Anorexia is more than a problem with food. Someone who suffers from the illness starves themselves to feel more in control of life, and in some cases to ease tension, anger, or even anxiety. There are two types of anorexia. The first type is the restricting type, where weight loss is achieved by cutting or restricting calories, dieting, excessive exercise, or fasting. The second type is called purging. Weight loss is achieved by vomiting or using laxatives or diuretics. The National Institute of Mental Health estimates that 1% of women and adolescent girls suffer from anorexia nervosa. 85 to 95% of anorexics are female. The percentage for men and adolescent boys with anorexia is much lower, about less than 10% of reported cases, give or take. But unfortunately, the numbers are creeping up. More than 1,000 women die each year from anorexia nervosa. Most people who have anorexia have a low body weight for his or her height, resist keeping a normal body weight, and for girls or women have missed 3 menstrual periods in a row consistently. Anorexia can lead to serious medical conditions such as low blood pressure, changes in brain chemistry, abnormal or slowed heart rate, reduction in bone density, muscle loss and weakness, the skin will bruise easily or even turn yellow, swollen joints as well as fractured bones and osteoporosis, also anemia and other blood problems, constipation, bloating of the stomach, dehydration, sometimes leading to kidney stones or even kidney failure, brittle, dry hair, skin and nails, low potassium, magnesium, and sodium, heart palpitations, meaning fluttering of the heart, and in severe cases, anorexia can lead to death. There are many signs that someone may suffer from anorexia. Signs to look for include making him or herself throw up, also known as purging, taking pills to urinate or have bowel movements, not eating or eating very, very little, taking dietary supplement pills or obsession with dieting to the point of starvation, excessive exercise like stated before, intense drive for thinness, weighing their food, counting calories, carbs, avoiding food altogether, eating very small portions or only eating certain foods, moving food around the plate instead of actually eating, refusal to maintain a normal or healthy body weight, like stated before, denying feelings of hunger, also becoming socially withdrawn, and emotional changes, such as irritability, depression, and anxiety, like stated previously before, are all physical signs of anorexia. They also include thinning hair, dry, flaky skin, cracked or broken nails. Researchers have found that there are many things that can cause anorexia. One of the things that may trigger an eating disorder such as anorexia is culture. Women in the United States are constantly under pressure to fit a certain look. Women see fashion models and associate being thin with beauty, causing women to feel the pressure to have the perfect body. A person's family or background can also negatively affect them and activate wanting to be thin, causing anorexia. If you have a family member or a close relative with a history of the disorder, you are more likely to suffer from the illness. Parents who are critical on themselves or their children often project a need to look a certain way, in which can encourage anorexia nervosa or other eating disorders. Drastic lifestyle changes, stressful events causing trauma can lead to the onset of anorexia. Sometimes people are unhappy with themselves and their appearance, which is another way people can feel the need to change their look or lose excessive weight or become anorexic. In one case, a woman named Marge Hodgkin became anorexic later on in life. She was a nurse from South Carolina in her 40s with a family. She felt a real sense of empowerment from the illness. She stated she could do it all on her own, no one was helping her, and she was achieving what she wanted to fit into her clothes better. Margie would not eat more than 200 calories per meal, and if she did, she would purge, forcing herself to vomit. Margie's anorexia triggered wild mood swings. As stated before, mood swings are symptoms or effects of anorexia. The disorder was ruining her life as well as her husband and her children. In order to treat or overcome this terrible illness, there are steps that need to be taken. The first step is to admitting that you have an illness. Once you know that you are ill, you can move on to the next step, which is asking someone for help. You can confide in someone you trust, or you can keep it totally anonymous and call a hotline. It may be hard to open up and tell someone the secret you've been dealing with, but it's a step in the right direction. Do not feel ashamed. Stay away from people, places, or activities that trigger your obsession with being thin. Step 3 is step 3. And lastly, you can seek professional help. There are many clinics to help you. They have rehabilitation centers as well as outpatient places. Therapy can help too. Trained eating disorder specialists are there to help you regain your health, help you eat normally, and develop healthier eating patterns. In serious cases, medical treatment may be needed. Anorexia nervosa is one of the most common psychiatric diagnoses in adolescent women. Between 5 to 20% of individuals that struggle with anorexia will die from it. Anorexia has one of the highest death rates in mental health issues. And with all that being said, anorexia is a very serious illness that can ruin anyone's life. Many people feel as if it is a disease for those who are vain, but in reality, it's a psychological illness. And hopefully from the information you have just received, you know what signs to look for and can help prevent or stop anorexia nervosa, as well as spread awareness to all.